At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Constipation When the Going Gets Tough on Wednesday, August 20th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. Welcome to the program. We've got some interesting data for you, and it's because you're all plugged up. What do I mean by that? Well, what I mean by that is constipation. We've kind of touched on the subject a little bit, and coming up on the 20th at the Roselle Center for Healing in Fairfax, Virginia, and Dr. Qinglong Zhang and I will be doing a program on this subject, constipation, and why you're all bloated up and the problems it can cause. Everything from headaches to migraines to inflammatory reactions, toxicity within the body, autoimmune conditions. I mean, the list is huge. But what we're going to talk about today is constipation and blood pressure problems directly and indirectly. And it could be one of the reasons that you can't get your blood pressure down directly. Can it happen simply because you can't move your bowels? Well, the answer is yes, but there's also other pieces of the puzzle. So let's talk about why you're all plugged up. And, the reasons really are anything from stress, not taking the time, not eating the way you're supposed to, not getting enough bulk. Water is a primary consideration for that. So when you understand that you're dehydrated and things turn into cement in your belly, there's no way that you're going to get out. And if you do, it's very painful and you could bleed as well. So, constipation can or cannot directly cause hypertension, but the short answer is it does it on a regular basis, potentially cause bigger problems than we want. The short answer is yes. So let's get into it a little bit so you understand really what I'm talking about. There's a lot of publications out there, tons of studies that show that people that are constipated have a much, much higher risk of developing hypertension. And that's because of the pressure that it puts on what's called the portal system, and that's your blood supply, your venous system, your return circulation, and so forth. And so if that's the case, then we have to explore, why these blood pressure problems are so high and not dropping, and why they're not dropping from a different place, a little dark area. So, when you're not drinking enough water, for example, and you have this very, very hard brick-like stuff in your intestinal tract, and you're pushing hard to bring that stool out, right, to get rid of it, to make you feel better, your blood pressure go up. But here's the other thing I want you to think about as we're kind of touching on a very, uncomfortable subject, if you will, that the blood pressure problem that's there also increases your risk of triggering a cardiovascular event or triggering a stroke. Now, so your heart and your brain are both at risk if you're constipated because of the increased pressure that is being exerted just to move that through. And often it's something very, very, very simple. Actually, two things. One is water. You guys just don't drink water. And everybody thinks it's for washing, and you're supposed to be drinking it. And the second piece is that you're getting no exercise. You're not moving. Peristalsis, that movement from, down the food tube all the way out to the exit, is often dependent totally on your exercise or your movement or just walking, and we don't do it. But so the mechanics of this, the constipation can also affect the fight-flight system, which we call the automatic nervous system. And it plays a major, major role of that blood pressure regulation. So it can absolutely, without doubt, cause problems with us. So what's the other thing? Let's walk it through. Why does this cause a problem? Now, remember we talked at one point, if you can follow me, that your intestinal system, if it has really good bacteria in there, produces all kinds of necessary neurotransmitters and things like that that are used everywhere in the body. But if the microbiota, the good bacteria, the gut bacterium is not good, and it can be altered significantly because you're constipated, because you have all this poison in your system, and that poison begins to disrupt, destroy, and alter that good bacteria, it can cause potentially all kinds of other problems, one of which can be constipation. Now, we touched a little bit that constipation can cause cardiovascular events. That means your heart. And it can cause cerebral events. That's your brain. So when we look at that, those cardiovascular events, those stroke potentials that are there, are significantly elevated at a risk level, particularly when they're combined with somebody who already has a low level of hypertension. And the risk of a major adverse event is exponential. That means you're going to stroke out, you're going to bleed, and you may die. Or you're going to have a heart attack, and you may end up dead. Or minimally, you're not going to be the same human being that you were before that took place. So if that's the case, we got to fix this thing, right? We got to make a difference. Patients come in and they tell me, well, I drink water. Yeah, you may drink about a half a cup a day, maybe a cup if you're lucky. And we all know that what our target weight or amount of water is you take your weight, you divide it in half, and that's the number of ounces of water that you should have on a day-to-day basis. So if that's the case, and you're only drinking just a little bit, and then you're adding coffees and teas and sodas, which are also dehydrating on top of that, guess what? You're playing Russian roulette. It's not a matter of if it's going to happen. It's a matter of when it's going to happen. Now, if you're constipated, let's go back to that, what I said earlier, the poison that builds up, the inflammatory reaction that builds up, the swelling that comes about because of the inflammatory levels of your gut. Everybody wants to go detox. Everybody wants to go out and get rid of the parasites. Let's start with supporting normal peristaltic function. Let's get that, from the mouth to the other end as quickly as we possibly can. And it should happen, actually, in a perfect world, it should happen several times a day, at least minimally once, but you should have a bowel movement every time you have something to eat. It's like you're making room for the next, stuff down into the system. But how many of us really do that? There's a few, but not many. Constipation causes increased risk of all kinds of things. We talked a little bit about back pain and migraine headaches, and we may get into that a little bit more over the next few weeks leading up to the program. But what I want you to know, I want you to understand that that constipation problem is a result of several things leading up to disaster. Right now we're talking about hypertension, blood pressure problems. Now, you got to manage it by several things. Medications are not the way you're going to manage this. Your body wasn't, your intestinal tract, your migraine headache, your aches and pains aren't medication deficiencies. It's not because somebody forgot to give you the drug. It's because you caused a problem that they're trying to solve with the drug, and there's many other ways of making that happen. So when you need to find out why it's there, you have to look at other situations. I have patients that come in and at the Roselle Center, and they tell us that, they had an accident. And I said, okay, great. So when was the accident? And they may go back about 15 years, 20 years ago. And I'll say, okay, so, tell me what's happened since the accident. They look at me, what are you talking about? So let's start with something obvious. Are you in pain? And the reason I lead with pain, particularly if they have a constipation problem, is that they may have been put on medications. And many of the medications, matter of fact, most of them that they use for pain, one of the primary side effects is constipation. So we lead with that, right? So when was the accident? What kind of medications have you been on? Then the question follow up is, when did you start noticing that your bowels were getting backed up? And suddenly they begin to say, oh, I didn't think that had anything to do with anything else. And so we try to correlate as much data as we possibly can. How about those of you who are out there and basically all you do is you have a candy bar and a bag of chips for lunch and you end up with a pot of coffee. And I said, why are you drinking so much coffee? Why are you eating those chips? Why don't you take the time for it? There's always an excuse, but here's the deal. You know that caffeine that gives you your morning constitution, you mean you're going to the bathroom? Well, here's the deal with it. Your body will get numb to it, and pretty soon it doesn't work. So you end up using more. It's like any other drug. Caffeine is a drug. And if you're drinking a ton of that drug, your body adapts and it tries to modulate itself. It no longer upregulates you. It actually will downregulate the system, and it'll make you feel worse when you don't have it, and you get more tired, and pretty soon you need more and more of some sort of stimulation to get you above threshold. Kind of lousy picture, isn't it? But that's really the way it happens. It's an ongoing process that it can cause other things. But we're talking about that blood pressure situation. And, people got on all kinds of meds and drugs and so forth. And there's an article that I read in Nature magazine. It's one of the better magazines. You all should read it on an ongoing basis. And it was talking about hypertension research. And the conclusion, this goes back this year, by the way, this spring, and it says the title of the paper was The Inseparable Relationship Between Constipation and Blood Pressure. So even though you go into the normal medical journals and they tell you, well, maybe not so much, but the point of it is there is all types of case studies, reportings that says that when you have a constipation problem due to whatever problem, that your hypertension potential goes up, right? And then guess what they do? They give you something called calcium channel blockers and diuretics. And know what they do? They increase the constipation problem. So then the constipation goes back and they cause an increased activity in something called sympathetic overdrive or overactivity. Now, what does that do? That causes a hypertension. So you got this loop. It's crazy. And then this constipation, remember we just talked about the gut, good bacteria, that no longer is good bacteria, and it starts disrupting something else in the colon called short-chain fatty acids, particularly something called butyrate. And then that upregulates to cause what? More hypertension. So it's a really ugly situation here. Constipation is one of the most frequently reported problems of the gut, and its bearing on health across the board is very finger pointing. If you're constipated, you're going to have bad health, but in the reports that are coming out, they're not just suggestive, they're very documented. The relationship between hypertension, high blood pressure, and constipation. What many of the guys that are publishing in papers said, we're not sure why it happens. Well, a few minutes ago, I just talked to you a little bit about portal hypotension, right? And if your portal tension is too high, meaning there's pressure in the supply, in the body, so you don't drain the blood off, the venous supply can't get, directed properly and so forth, then you've got a big problem, and it continues to get worse and worse and worse as time goes on. So here's what I want you to know. In the majority of cases, the patient comes in with a ongoing chronic headache that is not due to some sort of trauma, car accident, falls, blows, blah, 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 blah. It's invariably related to something that is going inside the body. And that's often a constipation problem. Your body's not evacuating properly. It's not getting rid of the things. And it's usually and the blood pressure problem is usually hypersystolic blood pressure. That's the top one. When somebody tells you got a blood pressure of 124 over 78, the top one, that 124 is systolic. The low one is your diastolic. But it seems to affect the upper portion more than the lower portion. So now you start elevating that blood pressure. You're still getting some relaxation in the heart after it pumps, diastolic pressure. But now you get uptight. Now you get angry. Now something else happens, and guess what takes place? You end up with a break in an artery. That's called a heart attack or a stroke, one of the several things that occur. So hypertension is very much related to that fight-flight system, and it decreases when you go into fight-flight, when you're constantly in overdrive, when you're constantly, in that place, it decreases the movement from one end of that system to the other. Now, what are you? You're constipated. You can't move anything out. You have all these poisons that are going into your system, and you're going to end up with other things, and that's called what? That's called headaches, and I don't feel good, and all of a sudden your blood sugars are going to shift. And he said, how can all those things be related? Well, they can, including cancer, if you're allowing things to rot in your intestinal tract, and it does take place. So moreover, constipation is extremely adverse in working this puzzle together because everybody's pointing someplace else. They're almost looking at, well, constipation is normal. Well, it's not normal. And you don't need other things to handle that blood pressure. Because, as I said a few minutes ago, if you go into those calcium channel blockers, if you take the diuretics, you're actually making things worse for yourself. Why is that an issue? I'm going to walk you through another piece of the puzzle and why it increases blood pressure problems. When you go into these calcium channel blockers that are supposed to lower your blood pressure, it also drops magnesium. It also drops other mineralizations in your body. And this is a vicious cycle. That by itself now does what? Increases the blood pressure. And now you got other issues that are going on. So it all starts with that gut that is not working the way it's supposed to work. Now, on the 20th, Dr. Zhang and I are going to go back and forth a little bit. I'm going to talk about that intestinal system. I'm going to talk about your blood pressure problems. And, if you're there and you join us, and I hope that you will, all you have to do is go to rosellecare.com or go to drtomroselle.com and register for the class, or you can call 703-698-7117. If you don't want to wait for the night, you want somebody to figure it out, you want somebody to talk to, call that number and say, hey, listen, can I talk to one of the docs? And, I need to talk to them about something, health problem that is personal. Nobody wants to talk that you're all plugged up on the phone, do you? Well, you might, but it's, a lot of people won't, but we're going to keep it very private. Somebody will call you back, and one of our docs will, and we'll make sure that you have some answers. But here's the truth. The truth is that if you're constipated, you got all kinds of problems going on. And one of them is inflammation, an inflammatory reaction of the blood vessels in your body. And when those blood vessels are swollen and they're irritated, they're not going to respond the way that they should. That's another reason that blood pressure starts cranking up. So when we look at that whole pathway, we're going to look, okay, are you on a blood pressure medication? Are you on something called an HCTZ, which is a diuretic, which releases salt from, salt and water from the blood into your urine, and it inhibits the contraction of smooth muscle. But as a result of that blood pressure medication, now you increase your constipation even more, because if there's no contractility, if it's relaxed, there's no peristalsis. If there's no peristalsis, guess what's happening? Your blood pressure is going up, my friends. It's going to be a problematic situation. So you have to understand the linkage here. It's super important. We talked a little bit about something called butyrate. And there's another one called propionic acid. And these guys are super important in keeping that intestinal system in a good place, making sure that, remember the microbiota, the good guys that should be there, they are part and parcel, back and forth. They support it, meaning the production of short-chain fatty acids. Short-chain fatty acids, produces the area of support for the good bacteria. So if your gut's not good, you're not moving, you're rotting, things are not bad. You pass gas and you kill everybody in the neighborhood. That's called a clue. But the clue even comes before that. And, I've seen patients that they think that moving their bowels once a week or once every 3-4 days or at least every couple of days is okay. They're out of trouble because that's what their doctor told them. But it's not. It's not okay. And you have to, if you want your health to be good, you want your blood pressure to come down. You want to decrease your risk of a possible vascular event, meaning a stroke or a heart attack. You've got to get that blood pressure under control. And the key in so many cases is the intestinal tract. Now, let me tell you another piece that's going to cause constipation to occur and increasing all this. If your spinal system, the nerves that come off the spinal cord, you've got 31 of them. If one of those 31 nerves that happen to go to the intestinal system or the stomach or the colon is not firing properly because it has pressure on it, because it's being overstretched, then guess what happens? That target, that organ system called your intestinal tract, is not going to work properly and can cause you to go into a constipation problem. Now, it can go the other way too. You can increase peristalsis if the nervous system is involved, and now you have an irritable bowel, you have loose stool, you have the cramping that goes along with it. That all can come from a spinal system problem. Only someone that does the work that a chiropractor does, that we do in the office, specializing in applied kinesiology, can determine whether or not there is presence of a spinal condition that we call spinal subluxation, where the vertebrae, the bones of your spine, are a little out of position. In a way, they're causing that neurological trigger, that finger pointing, to be irritated. So I don't know about you, but in my world, when I see these things happen, meaning patient has hypertension, doctor has them on all kinds of meds, we're on diuretics, we're on calcium channel blockers, we're on even things that relax the nervous system, it's called tranquilizers of some sort. All of those things have a significant impact on intestinal function. And the catch-22 is that when you're doing something to supposedly help this hypertension, you're increasing your risk of exacerbating it over time. Because what it's meant to do causes the same symptoms, hypertension, than what it is that you're trying to resolve. It's crazy, right? It's ongoing. So, we're coming up to a place where we got to think about this, but don't forget, it's on the 20th at the Roselle Center for Healing. We're going to have fun. You know that we put out a ton of data, a ton of information, and we want to make sure that you have everything that you need. So we're leaving. We'll go to the live stream right now. You're listening to Dr. Tom Roselle Live. Join me immediately. Remember, I'm here every Sunday for one reason only. I love you all. Have a great day.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Constipation When the Going Gets Tough on Wednesday, August 20th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.